for a live program where we will be addressing issues which are very, very important in the area of dermatology for both elderly persons and also persons with disability. I'm glad that you've chosen that topic for us, because this is a topic which is very close to the initiatives I've been taking. First, with the setting up of the Global Rainbow Foundation to serve persons with disabilities, and the University of Third Age with the elderly. So both of them, many of the participants online now are from these two groups of beneficiaries that we have. And we are also, this program is live on Facebook for the benefit of many of our viewers and participants in our regular webinars and in our regular medical talks that we organize online. So let me say that Global Rainbow Foundation and me personally, we are very happy to be associated with Dr. Dinesh Kumar, MD, FRCP Glasgow, FRCP London, an amiable, resourceful, and popular dermatologist from Chennai, India. Dr. Dinesh is, in addition to his full-time clinical patient care, plays an active role in national and international international dermatology and medical associations, and has contributed to be in a meaningful way to the betterment of the society. He has been honored that I will be mentioning that aspect later, a very great prestigious award that he received. But in addition to this special award, he has been awarded Honorary Distinguished Fellow of Global Association of Physicians of India origin, and is the Honorary Fellow of the Academy of Medical Sciences of the Indian Medical Association. Dr. Dinesh was awarded the Dowling Club Scholarship by the prestigious Dowling Club, an affiliate of British Association of Dermatologists, who attend clinics in the United Kingdom. Dr. Dinesh has more than 100 invited lectures at various conferences and CMEs to his credit. And I'm pleased to announce that Dr. Dinesh Kumar has graciously agreed to provide medical guidance and telemedicine services to patients, and we are still working out the modalities for that, for persons that the Global Rainbow Foundation, Mauritius and India will refer. And I personally would like to wish Dr. Dinesh still greater achievements in his career, in medical field, but most importantly, having known him for a few months now, I must say, I've got to see the man with a deep sense of humanity, somebody who cares for humanity, and he is not a professional or a medical professional who is looking only at the job, but is looking at how can he best serve the patient that come to him, and also to serve humanity more generally. So I am confident, Doctor, God will bless you with this. God will bless you with this sense of mission that you have to serve a person with a disability, to serve people with a problem of dermatology, and we wish you continued success. But let me now
I'm absolutely delighted to be with you all. And
sorry, Doctor, sorry, I've just concluded.
Yep.
Sorry, Doctor.
Please go ahead, sir.
Yeah. Let me also say something very special about Dr. Dinesh Kumar. He has recently been honored the Doctors' Day Award 2022 for academic excellence by the Indian Medical Association, Tamil Nadu. And Dr. Dinesh Kumar holds the distinction of being one of the youngest to hold a Secretary General post of Indian Association of Dermatologists, Venerologists, Leprologists, and Association of Cutaneous Surgeons, India, and Indian Society of Teledermatology, and is the first to hold the office of Secretary General in all the three International League of Dermatological Societies affiliated national dermatology associations. He is also the first Indian to hold the post of Secretary in the International Dermatology Association. So our dear viewers and listener participants in this talk will appreciate that we have in front of us today a very distinguished personality in his field, in the medical field. And before I invite Dr. Dinesh Kumar to address you, let me show you a short video of the award that he received on Doctor's Day Award ceremony. So I will invite Keshini to show the video, and then I'll give the floor to Dr. Dinesh Kumar.
Yes, sir.
Association of Dermatologists, Secretary International Society of Teledermatology, Secretary General Association of Cutaneous Surgeons, Secretary General Indian Society of Teledermatology, Vice President IAGBL, Member Policy Network.
Sitting Secretary General of the Dermatology Association of India, and one of the youngest recipients today. Hats off to your contribution to the association. They're getting this on behalf of all of them.
We are moving ahead to the next set of awards.
Well, Dr. Dinesh Kumar, we are very honored. I'm sure you and the family and Dr. Aishwarya Rajan must also be very happy with this, but we are proud of you, and I wanted to show this great distinction that you've got, and I know there's more to come for you. So now I leave the floor to you, and I know our participants in Mauritius and globally are eagerly waiting to hear from you. On to you now, Dr. Dinesh Kumar. Thank you.
Yes, sir. Thank you very much for your kind introduction, and I'm truly humbled to be associated with you, a person of your stature, and invitation from you I couldn't refuse, and I'm very happy to be a part of the GRF family, and it's absolutely a delight to be sitting here and addressing you all in Mauritius. And I always believe that we have a duty towards the society. We have to always give back to the society, and all of us have a mission in life, and we are born with a purpose. And it's truly inspiring to see Dr. Artmugam Parshuraman give back to the society in various spheres of life. And he continues to inspire others, and he inspires me too. So with these words, we can start off with today's proceedings. So today we are going to discuss about what care of the skin we can take, skin and hair care in elderly and also in people with disabilities. So we can go ahead, start. If there's anybody feels at any point of time any issues they want to address or ask me, I would be more than happy. And if there are any specific issues you're looking at to ask also, you're free to ask me. Yes, sir. Do you want me to have a kind of a didactic discussion, or you want to talk about it?
It'd be good if you can. I would prefer that you give a general introduction on the topic that we have chosen for your talk, and then we will come with questions.
Okay, so basically, if you look at dermatology, I'm a dermatologist. Basically, that means that I'm a specialist who deals with skin, hair, and nail issues. Now, per se, if you look at dermatology, many people wouldn't give that much of significance to dermatology, simply because most of them, they think that most of the dermatological disorders are not life-threatening, and you wouldn't have any harm to your life. So most often the dermatological diseases or skin disorders often take a back seat, but it's not so. The face is the mirror to the mind, so is the skin a mirror to your body. So many a times it so happens that what changes you notice in your skin, some early changes which we pick as dermatologists pick up in the skin, could be a reflection of your inner self, could be a reflection of your inner body metabolism, could be a reflection of your inner body functioning. And these clues help us to diagnose many a times many systemic disorders. So I would like to really start off with by saying that dermatology is a very vast field, a very uh, expanding field where innovations and research is being constantly done and new therapies are coming up. And this is a field which shouldn't be taken lightly. And it is here where we can help people and make a significant change in people's life and help them to better their lives and improve their quality of lives, most importantly. Now, looking at specifically at elderly people. Now, elderly people and people with disabilities or impaired mobility, they do have very much similar requirements. Now, for example, one is the mobility part of it. When you are immobile, there are certain skin changes which you need to really look out and take it early. And here the function or the role of the caretaker is very, very important. So in addition to educating the patient, we also need to educate whoever is the caregiver or a primary health caregiver, which could be a nurse or it could be a primary care physician also. So they need to be taught to watch out for early signs and symptoms of skin diseases and to pick up early changes. And you need to have a tele-dermatology facility. I will be discussing on tele-dermatology also later. Now, tele-dermatology is something of a boon to mankind, I would say, because it helps us to reach out to far-flung areas, areas with not much of access to healthcare, where it is difficult to travel. And like I'm sitting now in Chennai, in the southern part of India, and I'm talking to you in Mauritius, across continents. So this is how tele-dermatology could also help. We could really provide medical services to the disabled. We could provide medical services to people who are immobilized or because of their age, the geriatric population not able to move around. A simple photograph or a simple video call could help to resolve a lot of skin issues and help them better the quality of life. This is something. Now, there are certain skin issues which are very specific to the elderly populations. Like generally what happens is when you're looking at elderly age group, the most common problem what we see is pruritus. Medically, what we call pruritus is simply known as itching, the urge to scratch. Now, what happens is when you are younger, your skin has the capacity to produce oil, and at the same time, it also has the capacity to retain moisture. Now, when you're getting old, the skin loses this function, these two functions. That is, the oil production capacity, the natural moisturizers or the oils or the sebum in the skin gets reduced, the production of which, and also the ability to retain moisture also reduces. Now, when you look at soil or the earth, whenever there is lack of water or whenever the famines, the earth cracks up. The skin is very much similar to that. So you look at a dry skin which is lacking in moisture, which is lacking in natural moisturizers and does not have the ability to hold water, the skin just breaks up. The barrier function of the skin, what we call, is compromised. And this is precisely the reason why you see many elderly individuals scratching for no reasons. You may just wonder why are they scratching their skin when you feel the skin apparently looks normal. The simple reason being dryness. So dryness is something which most of the elderly individuals experience, and this scratching is an addictive phenomenon. Once you start scratching, your skin is damaged, and over a period of time, the skin gets addicted to scratching. So we need to take care of dryness. That is one important thing I wanted to stress on in elderly care. See to that your skin doesn't get dry. Now, this is very simple. You'll have to use a moisturizer. Simple moisturizers. As much as possible, try to use moisturizers which are free of fragrance and they are easy to spread and they do not block your pores. This is point number one. Second is your general habits. Now, when I say general habits, your bath time. The most important thing is the bath time. Most of the elderly individuals do tend to spend a little more time in the taking a bath. This could be simply because of mobility issues, or also it could be simply because when you use a lot of hot water, your itching seems to disappear at that moment. So by using a lot of hot water, you're doing more damage to yourself. So try not to use too much of hot water, and bath time ideally should be somewhere between 5 to 10 minutes. So this is equally important, and please do not lather up yourself too much with soap. because soaps most often are alkalis. And if you look at the skin pH, that is something what we call the acid-base balance of the skin. It is more on the acidic side. So always use cleansers or bars which are close to the skin pH. This is one thing. Now, having said this, the one more thing which we often forget when using asking patients to take bath is see to that in elderly individuals the floor is non-slippery, and also you have railings or something in your bathrooms to hold on in case you slip, because again most often falls in the bathrooms are very common in elderly people, resulting fracture of the bones, especially the neck of the femur. So this is something, if a person is using bath oils or anything, this point should be kept very much in mind. So along with senile pruritus, there are other changes. The skin, as you age, the ability to repair the skin reduces. So obviously wound healing takes a little longer time. And also people, because of impaired immunity in the elderly, they are more prone for infections. Now, infections could be on the skin or it could be on the mucosal membranes. When I say mucosal membranes, it's the oral cavity and also the mucosa of the genital area. So in women, it's most commonly the vulvovaginal candidiasis, and in men also you could have candidial balanitis, or the infection of the private parts with the candida type of fungus. You could also have a similar infection of the oral cavity, what we call as oral thrush, and also there could be superficial fungal infections in your body folds. Again, in elderly and immobile people, this is a very common condition where, because of lack of care or lack of proper cleansing, the body folds, especially the groin area, the underarm, and in women, the areas in between the breast or under the breast, because of the accumulation of moisture, they tend to become macerated and create a fertile ground for the fungus to grow. So again, this is something which we should take care of. We should keep these areas dry as much as possible, well aerated, wear loose-fitting cotton cloths, and see to that, most importantly, we tend to, with the advent of COVID, what we are doing most often is trying to use overdose of sanitizers. We are using a lot of harsh detergents and also so-called antibacterial liquids, not only to take bath, but also to wash our clothes. Now, this is something absolutely unnecessary. You don't really have to use too much of a sanitizer, especially if you're in a protected environment. And at the same time, there's no real need for you to use any antibacterial soaps or antibacterial liquids, either to take a bath or to wash your liquids. By doing this, you will end up irritating your skin, and not only you end up irritating your skin, but you end up removing the friendly bacteria which is present on your body. It's not only the friendly bacteria, but the whole lot of normal friendly microorganisms which grow on your skin. So once you remove the friendly microorganisms, you're creating an invitation for the pathogenic or the harmful bacteria and other microorganisms to come and invade your skin. So this is something I would like to stress on, and see to that you do not use any antibacterial agents in your day-to-day routine. And sanitizers, most often we are seeing people using sanitizers now and then, and that results in hand dermatitis and dryness of the hand. This is especially true in women homemakers, where they tend to use a sanitizer every now and then. So they are more exposed to washing of the vegetables or the utensils, and this creates again a sodden skin which can predispose individual to hand dermatitis and infection of the hands. Similar situation can be seen in people who spend most of the time in standing in water, the elderly especially, if they do not have the capacity to dry their feet or the area in between the toes. Now this can lead on to a very common fungal infection in between the toes called intertrigo, or also a fungal infection. So these are the issues which we need to really look out in elderly. And in immobile people, we need to have a proper care in case the person is not capable of taking care of himself or herself. We need to see to that the individual has is being taken care of, is being properly cleansed. The products what are being used is vetted by a primary care physician or a dermatologist if possible, and also regularly the body folds, the hair, the skin is made checked up, and any deviation or aberration is reported to the primary care physician or a dermatologist. So this would be a basic healthcare. Would you like to ask me anything in specific, sir? I think you're on mute.
So thank you very much. That's a very clear presentation. And now I will hand over to Dr. Divla. Dr. Divla.
Hello,
Yes,
good morning, everyone.
1 minute, Dr. Divla. I'll now introduce Dr. Divla, who is the head of the medical team at Global Rainbow Foundation. She's a generalist, and Dr. Divla will now take over. And we have received some questions from our patients and people we know, and so therefore Dr. Divla will be now taking over in terms of presenting the questions to you and also adding her own comments. Right? Thank you, Doctor. Once again, I will now invite Dr. Divla. Please take over.
Thank you, Dr. Dinesh, for agreeing to participate in this webinar. So, as you said that elderly people, they have natural changes in their skin, which causes a dryness and the eczema and the excess of the itchiness. So, we also notice that elderly people suffer from fungal infection, repeated fungal infection, and also some people who wear diapers, they suffer from some skin rash. So what kind of advice you will give to them, and why these people are prone to the fungal infection?
As I told you, see, as we age, the skin's immunity reduces, the bodily functions reduce, and that's a part of aging. So when your immunity is compromised, obviously you're more prone and open up to infections. So, and generally, if you notice that fungal infections, the moisture is the main thing of the skin. So generally, fungal infections, you look at them, they generally come in areas which are more prone for moisture, like your body folds. It could be the underarms. In women, it could be the area in between the breast, and also it could be the area under the breast, and the groin area commonly both in men and women, and also the gluteal area, the buttocks area. So these are the areas which are not exposed to the external environment, and the only time you're exposed to the external environment is during your bath, and again during your bath it's a wet environment. So the moisture creates a very fertile ground for the fungus to grow, and that's why the fungus grows. Now this is one point. There's another point is in elderly and people with disabilities, there's not much of anticipated sun exposure which is happening. So most often these individuals are deficient in vitamin D. Now generally vitamin D is an essential vitamin, and the deficiency of which leads to a whole lot of problems. But with regards to dermatology, I would like to stress that generally people who are deficient in vitamin D, they are a little bit prone for what we call as surface infections, that is infections occurring on the surface of the skin. The fungal infections are surface infections. So generally when this is also taken care of, the vitamin D supplementation, checking the vitamin D levels of the blood and supplementing with vitamin D, generally the patients tend to improve. Now with regards to diaper, that is a necessity which we cannot at times really bypass. Now the only way is trying to constantly change the diapers and trying to use zinc oxide creams. Now these creams are barrier creams or sealant creams, zinc oxide and petrolatum creams, which will kind of create a barrier, and even if it gets moist and macerated, they will at least minimize the damage. But as I told you, we need to have a well-trained caregiver who's going to identify these early signs and pick up these early signs and convey to the physician.
Okay, so apart from the skin changes, eczema and fungal infection, what are the other common skin and hair issues in elderly people and people with compromised mobility?
Okay, now one thing is just not looking at the disease part of it. We also kind of look at the need to look good, feel good has been there since time immemorial. So as we age, the skin and the hair undergoes a lot of changes. People start losing hair, people's skin starts changing. So these are the common things which you see, and many a times this is swept under the carpet, saying that okay, we have grown elderly, there's no real need to look good. But this is as a doctor, I do see a lot of elderly people in the above 60 age group who really need a feel good. So here also again we need to look into proper skincare regime, a basic usage of a sunscreen and products which will improve the texture and pigmentation of his skin, and also the hair thing. So these are some things which we need to look out. We can also see other issues like senile comedones. Now people who are very much exposed to the sun, the skin becomes lax, and because of the aging of the skin, they develop something called as comedones. These are like prominent, very open pores, and with what we call commonly as blackheads and whiteheads. So generally they can develop this under the eyes, and sometimes you can have Dermatitis neglect. This is pretty common in people with disabilities and elderly. Now this could be a combination of apathy, where the individual is not really bothered to take good care of the skin, or it could be because of inability to cleanse in the skin also. So here what happens is the dead skin, the debris of the skin accumulates, and this creates a condition which looks like a skin disease, but most often when proper cleansing is initiated, this automatically is taken care of. Now again, because of lack of nutrition or nutritional deficiencies which are common in elderly and disabled people, we do see some changes in the nails, like brittle nails, changes in the color of the nails, shape of the nails, and also the skin healing kind of takes a back seat. You can have easy bruisability of the skin, that is trivial trauma can really produce bruises in the skin which take a longer time to resolve. So these are the other skin conditions which we see. And yes, in elderly disabled people, something is like scabies is something which we need to really watch out, especially if it's a group of elderly individuals or immobile individuals staying at a home or a facility where they are very much similar population staying. So scabies is something you really watch out and try to initiate therapy. And also lice and pediculosis, what we call as pediculosis of the scalp. So lice infestation of the scalp is again something which we need to really watch out for. And many times the hair gets matted, people are not really able to comb their hair, so the hair gets matted, and these are things, yes, in addition to what I had previously spoken about.
Okay, so as we all know that skin aging is a natural process. Okay, we can reduce its effect, but we cannot avoid it.
It's
When it
inevitable.
has to occur, it will occur. Yeah. So I have seen in my patient that for them it's very difficult to accept these facts. What advice would you give to these kind of people, especially people suffering from hair loss or wrinkles or any other skin issues, dry skin and all? What advice would you give to this?
Now skin and hair per se has got a very strong relationship to the mind and the psyche of a patient. Now, as previously discussed, your skin is a reflection of, or it's a mirror of you to the outer world. So many a times it can impact your confidence levels. It can, the way you look, if you look good, can impact your confidence levels. So basically, we need to have proper counseling in place. This is very, very important. See, most of the patients, they try not to come to a skin doctor. One, it could be the ignorance that this particular entity could be treated. Almost all the dermatology issues are treatable. So this is a lack of information or ignorance where they feel, okay, I have got this condition, may not be treatable. So this is one thing. The second thing is the inhibition of them. What will the doctor think, or what will the person think that I'm approaching them for such a trivial issues? So this is where I initially told about, let us not trivialize skin issues. Every skin issue is an issue which concerns the psyche of the patient and which will have an impact on the patient. And when improved, it will really provide a positive outlook to the patient. So we need to counsel the patients very well that what is the physiology going on in the body, and this is a kind of inevitable, the aging or changes related to your skin or the hair. These are very inevitable changes, but there are therapies, there are treatment modalities which can help you to slow down the process, which can help to make you look good, better, or feel better. So counseling goes a long way, and it's not just that when you go to a doctor, you take the treatment and that's the end of the story. No, I always counsel my patients, the treatment is one part of the treatment strategy, but the main treatment remains with you. Having a positive outlook towards life, meditation is a part of the lifestyle, and having a proper food regime. When I say proper food regime, eating a healthy diet, a more of a home cooked food or a plant-based diet, and also trying to involve in as much as possible. I understand with people with disabilities, the physical activity is a challenge, and even in elderly it's going to be a challenge, but whatever possible, involve in those physical activities, and most importantly having a sleep pattern, a good sleep pattern. Now again, this is a challenge in elderly and people with disabilities, but wherever possible, having a good eating pattern, the choice of food and sleep pattern really helps go a long way. And this is something I would want to stress, that along with the counseling, a patient needs to be counseled on these lifestyle improvement strategies also. You're on mute.
Yes. What daily basic hygiene do you think will help elderly and person with disabilities for their skin care?
As I told you, regular cleansing is a must. Now, many people they worry about regular cleansing, but yes, regular, especially the eczema, they think whether the eczema or dryness will impact. Like for example, atopic dermatitis, what we commonly see in kids, but also we can see in elderly. Here, the many people are like. Will regularly cleansing my child or the patient with atopic dermatitis person? Absolutely no. You have to regularly cleansing your skin. So first is regular cleansing. And what you use for cleansing is very important. Use non-irritant detergents and what we call as pH balanced cleansers as much as possible, what we call scented baths. So use them as much as possible for your regular cleansing. Your bath time should be very short, preferably 5 to 10 minutes. Your bath time should be adequate. You can soak your body folds like your hands, feet, your groin area, your underarm area, the area in between the breast or the breast. There's no real need to soak the entire body if you have a dry skin. Just a simple shower should do. And if possible, you could use bath oils also, but again, once not very heavy with heavy fragrance. And use lukewarm water. Please do not use very hot water or very cold water. Lukewarm water should suffice. And immediately after bath, pat dry your skin with a towel. Don't rub it hard. Just pat it dry and use a liberal amount of a moisturizer onto the areas except for the body folds. Now, this is a skin regime which will be enough for most of them. Now in the younger population, based on the skin type, whether it's an oily skin or a combination skin or a dry skin, we go for it. In elderly, most often what we see is that dry skin, so moisturizer should be very much in regime. With regards to sun exposure, if a person is a sun exposed person and is of Caucasian origin, we would advocate them to use a sunscreen because you have incidences of skin cancer more in Caucasian skin who are exposed to too much of sunlight, whereas a person with a pigmented skin, we do not expect much of skin cancers to happen. So that's about it.
Okay, so you have earlier talked about specific skin issues in women with disabilities of reproductive age. You've mentioned some, but what I've noticed is we have lots of patients with PCOS, polycystic ovarian syndrome, and we have patient girls with Down syndrome who suffers from this, I can see, and they suffer from the acne vulgaris and acanthosis nigricans. So many of them, they just go to the dermatologist. They don't know a proper way how to treat it. Some go only to gynecologists, some go only to dermatologists. What do you advise them?
Perfect. So this concerns the younger population because the polycystic ovaries and acne vulgaris, which is in layman's term called as pimples, is a disease of the younger population and of the women in a reproductive age group. Now, polycystic ovaries can at times be familial, that is a genetic origin, and most often it is seen in women on the heavier side, that is your body mass index above the normal. So what we call as obese individuals. So not necessarily obese, but sometimes even a overweight individual also could have polycystic ovaries. So if you look at polycystic ovaries, it's a very simple, to put in a very simple terms, that your ovaries are not functioning to the optimal capacity. So the production of the female hormone is reduced, and since the production of the female hormone is reduced, the male hormone dominates in a female. This is a very simple description I would give of polycystic ovaries. Now, there are some individuals who could not be overweight, whose body weight could be very much well within the normal body mass index, and yet they could have polycystic ovaries, what we call as lean PCOS. Now, here probably the lifestyle is to blame, and probably the belly fat, or what we call as the mid segment fat, is to blame. And also, when I talk of lifestyle, I'm talking what I stressed previously on improper eating habits. Most often these days, if you look, everything is available at a click of a phone or a click of a button on your internet. So processed food seems to be a very much integral part of our life. So processed food, any food which is processed, which has high amount of calories, sugars, salt in it, is a binger for polycystic ovaries and lack of physical activity. So this is something which we need to look out for it. And as I told you, once your female hormones are on the decline and your male hormones are on the ascendancy, so a person, a female, is very prone to get acne or oily skin. The person can also have dandruff, that is increased the shedding of dead skin of the scalp. They can also have hair thinning of the scalp, and they can also have abnormal hair growth over the chin area, on the face, and also the upper lip area. Sometimes even if it is too severe, there could be excess body hair growth also. And in the worst case scenario, you could have changes in your voice also. Now, it's not whether a gynecologist treats the polycystic ovaries or dermatologist treats. It's a work in tandem. Both the gynecologist and dermatologist should work hand in hand to treat a polycystic ovaries. And many a times, one common misconception, what I would like to say is, many a times, if your cycles are irregular, because irregular cycles is one of the indication of polycystic ovaries, but not necessarily always. So many a times when your cycles are regularized, the patient feels, okay, this is the end of the story, my polycystic ovaries is gone. It's not so. So there has to be a combined concentrated effort both by the gynecologist and dermatologist and with the patient to treat polycystic ovaries. So we have varying levels of treatment. Initially we go in for lifestyle changes, then if we run them through blood tests, and if the patient is diagnosed to have insulin resistance, we put them on drugs which reduce the insulin resistance. And if sometimes we also would give a hormonal kind of therapy also.
And also, in my patient with Down syndrome, I've noticed that they always complain about skin issues like dermatitis and dryness, itchiness. So these are young people around less than 30 years. So what kind of advice would you give to this kind of people?
Dryness is something common with most of the genetic issues. So we kind of expect dryness. So I would, as I told you, the bath thing I stressed upon, moisturizer, use of moisturizer. What we say is, after you bathe in water, bathe in a moisturizer. So that's the way to go. So liberal use of moisturizer. Now in Down syndrome, we need to again, either the caregiver or the patient themselves have to be educated on picking up early changes in the skin and communicating to us. So that will help. A moisturizer is very much part of a regime, and non-irritating cleansers, pH adjusted cleansers also should be a part of regime instead of using antibacterial soaps.
Because as you know, some result in sebaceous abscess also. I think of excess of scratching and lots of itchiness, because I have
Yes, that's
patients
what
who have.
your itching, your dryness is the one which creates the itching. So when a patient starts to scratch themselves, it creates a portal of entry for the bacteria. And with reduced care, they are very prone for these secondary infections. So it's always a good idea to have the nails trimmed, always kept at shorter levels in these patients. And if they are scratching themselves, just to have a watch out. Now, sebaceous cyst abscess, basically the sebaceous cyst is a occlusion of your skin pores. So once in some individuals, this can happen as a genetic issue. So once your skin pores are occluded, the debris of the skin, the oil production of the skin cannot escape out. So it creates a kind of a sac under the skin. And this sac most often remains quiet, but with manipulation or with constant fiddling with it, it can develop secondary infection. In that case, the patient has to be treated with antibiotics, and in worst case scenarios, has to go in for the surgery also.
Okay. And these people also they present with skin tags, small skin tags. Do you advise them to remove them or keep them? What do you
Now,
advise?
skin tags is basically it depends. See, most often, if you look at the normal population come to get the skin tags removed for cosmetic reasons. That is, they don't really like the way they look on them. And skin tags, if left them to themselves, it's a very harmless outgrowth of the skin. It's not a precancerous or an infectious condition which could spread to the individual or to the other individuals. Having said that, in people with disabilities or people who are not able to take care of them, I would prefer to get them removed, basically because they could be a source of secondary infection, because the patient may tend to handle them a lot. So there are no creams or medications to treat them. It's a very simple process where we either apply anesthetic cream, wait for 1 hour, or we can inject a local anesthesia injection, and then get them removed. So it's a very simple process. You can either remove it with a radiofrequency ablation or with a laser.
Okay, so can you, as you said that vitamin D, vitamin E, all these are very important for our skin and hair. So what kind of food do you advise the common people to take to prevent this early skin aging or hair fall that usually happens?
There's nothing like a proper diet, and there's nothing like a magic diet which is going to prevent aging or the hair fall. A lot of the hair fall and aging also goes into your genetics. But having said that, yes, a good lifestyle and proper selection of food is very important. A wholesome food. It's not like you try to restrict one particular aspect of your food, like your carbohydrates or your proteins or your fat, and then you try to overdo the other things. It has to be a very, very proper balanced diet. You need to take a proper intake of all the three, that is your carbohydrates, protein, and fat. See to that it's more of a plant-based diet. You could involve meat, you could involve white meat as much as possible, red meat once in a while, but white meat should be a preference. And the main important thing is, most of the food, if you're eating meat, let it be steamed, or let it not be one where you kind of deep fry it. That is absolutely should be avoided. And a big no to processed food. Processed food is something I would really advise all my patients to avoid. Anything which you pay money and buy from a store, or pick it up from anywhere where you have to pay money, open it up and eat, a big no. Because processed food is what we call as high glycemic index foods. Most often, as soon as you consume them, your blood glucose shoots up, and that is really not good. Whereas you look at green leafy fruits and vegetables, they have a low glycemic index. You consume them, your blood levels gradually rises and gradually falls down. So as much as possible, try to take green leafy vegetables which are rich in iron, fiber, and they're very good for your health. And also fresh fruits. If you really want to have juices, do have juices, but fresh fruit taken as a whole, they are very helpful. And try to avoid sugar as much as possible, and aerated drinks. And nuts and seeds in moderation. I would advise my patients not to overdo nuts and seeds, and especially not to take nuts which are salted or deep fried. And lots of water. You need to really take in a good amount of water. I wouldn't put an upper limit. Try to drink water as much as possible, as and when as you can.
Okay, so for this group of people who are physically challenged, who cannot go and visit a dermatologist regularly, what kind of advice would you give them? Is a regular visit necessary, or if they, what are the alarming symptoms that they are getting that they need to visit a dermatologist now?
Now, the thing is, basically, if you look at dermatology, most of the dermatological diagnosis is made by visual inspection, where the physician sees the skin in question or the lesion in question and makes a diagnosis based on his or her experience. Sometimes, to aid the diagnosis, we may go in for skin biopsies, or we may go in for blood investigations or any other skin test, but that is not in a very big group. And most of the individuals we are able to diagnose by inspection. So why I'm talking about this point is, dermatology as a medical specialty is well suited for telemedicine. So in telemedicine, you are able to look at a particular skin lesion, and you are able to provide a diagnosis, and provide your country has a correct framework of rules which facilitate teledermatology. Most often, a good dermatologist doing dermatology will be able to help you. Now, the skin patients have to be taught that, most of these elderly and caregivers of the disabled people have to be taught that to pick up early signs. So it's always good to have some training or initiation program where they're just taught on early skin changes, to look out for body fold, nails, the oral cavity, and if they notice anything abnormal, to inform the primary care physician. So anything which doesn't seem normal, or you're having abnormal symptomology like increased itching or scratching or discolored skin, you need to inform it to your caregiver or the dermatologist.
So basically, the caretakers of these people should be very well aware about these signs and symptoms. So what are other measures that you advise them to take for these people, especially for bedridden people?
See, bedridden people, the most common problem what we see is pressure sores. So a water bed or air bed is a absolute must. Constant change of position is a must, and as much as possible, try to keep the nails trimmed, because sometimes the only outlet they would have is scratching the skin. What we call is neurotic excoriations, and sometimes it could be a perineal excoriation or scratching also. So these things have to be kept in mind. Constant change of diapers is also something, and seeing to that the skin doesn't get moist, and regular cleansing of the skin and regular inspection of the body folds. So if we are doing this and well aeration of all the body folds, this would be more than enough.
Okay, doctor, we can see that in Mauritius, people with extensive psoriasis and even extensive vitiligo, which affect their day-to-day lives, they are eligible for a social help like any person with disabilities. So, how do you think that these things affect them and make the people as if unable to walk? To work and also unable to perform any other activities. People with extensive psoriasis and vitiligo.
Now, both of these are very visual diseases. There are some ways they differ, and there are some ways in which they may be similar. Now, both of them are, as I told you, very visual. So, a patient suffering from vitiligo or psoriasis is very much inhibited, because sometimes when it affects the visible part of your body, like your face, your hands, where you're very invited to present yourself to people or even shake hands. So this creates a lot of complex in them, and most of them, they do not really, they go into a shell and really avoid seeking care of a dermatologist. But one thing I wanted to say is both of these diseases are very much treatable. Now, vitiligo, if you look at it, vitiligo is a very harmless condition where there is loss of pigment producing cells in the skin. That's it. Now, vitiligo almost always does not affect either your longevity, does not affect your internal organs in any issues. So a person with vitiligo is as capable and as fit as any other person around. So vitiligo is more of a issue where we are looking at just a discolored skin. And first, we must be able to spread the word that every one of us needs to be comfortable in our own skin types and skin color. But having said that, vitiligo also is very much a treatable disease. Now, this most of the people are not aware. Most of the time, they end up going to quacks, or they're going end up going to unqualified people, where they seek treatments which are not approved and which could be more harmful to them than in more than one ways. So vitiligo is very much a treatable disease. When we are treating vitiligo, we look at 2-3 goals. One is trying to limit the spread of vitiligo. See to that the vitiligo doesn't spread beyond its existing area, or does it appear in new areas. The second thing is trying to bring back the pigment. Now, pigment can be regained either by medicines in form of application of creams or lotions or tablets which have to be ingested, or it can be treated with light therapy. When I say light therapy, what we call as narrowband ultraviolet B light therapy, or excimer light or excimer laser therapy. And in some cases where the vitiligo is stable, it can also be treated with surgery. Now, we can almost bring a near clearance of vitiligo these days with the advances which are happening in the dermatological field. Now, coming to psoriasis, again, psoriasis, the same thing. We talk about trying to prevent the disease spread, trying to resolve the disease and see if the disease comes back, doesn't come back again. But the issue in psoriasis is just not a skin disease. It is a disease which can affect your internal systems also. We have seen that people with psoriasis, especially people with uncontrolled psoriasis, extensive psoriasis, over a period of time develop obesity, develop heart issues, have more chances of developing diabetes, that is increased blood sugar levels, and also increased cholesterol levels. And not only that, the most important thing is generally these people also have a potential to develop joint pains. Over a period of time, they develop arthritis of the hands, and also even the larger joints of the knees also. So here the treatment is just not treating to make the skin lesions disappear, but we are also trying to treat proactively so that we prevent the further worsening of the internal function of the body. But we need to educate the patient. We need to create more awareness among the general public, like there are treatment for this, and these treatments are effective treatments which will help you to resolve the disease. And at the same time, we need to make people aware that to seek the help of a qualified medical professional for these issues.
Okay, thank you, doctor. I think vitiligo and psoriasis are two major topics. Maybe one day we can dedicate one webinar.
It's a very big topic, and vitiligo is something which is close to me. I try to consult my patients as much as possible on vitiligo. As I told you, we need to put it across that everybody who has vitiligo is as capable and as fit as every one of us, and every patient, it's not only just vitiligo, should be allowed to reach their full potential. And this is where the help of a physician or foundations like GRF come into play, so that every individual has the potential to reach what he's capable of.
So, just briefly, can you explain about the treatment that you have for, like you said, surgery for person with vitiligo and how much it costs?
Now, the surgery, basically, as I told you, the first intervention, sometimes it could be a simple light therapy, what we call as ultraviolet light therapy, ultraviolet B specifically, rather than UVB, what we call. This would involve multiple visits to the dermatology clinic or the hospital, or you could have something called the eczema light or laser also. And sometimes we go in for interventions like needling. With a simple needle, we just try to needle up the skin and then irrigate it with certain medicines, and this also has been shown to provide good results. Now, beyond this is the surgical treatment, where what we call as skin grafting. Now, skin grafting could be miniature punches of skin which we take from one part, for example, which we can take it from behind the ear or the inner forearm or the thighs and transplant to other area. Or these days we have ultra thin skin grafts, or also what we call the latest thing is the melanocyte cell transfer. So you take out the skin from the thighs, and in them you separate out your melanocyte, or that is the melanin producing cells. You culture them and you incubate them, and then you transplant on them to the vitiliginous site, or the area where the skin is lost its pigment, and the pigment comes back. Now, with regarding to cost, it varies country to country. It a lot depends on the country where one is, and also the reagents used, the expertise of the physician.
Okay, thank you, doctor. So we came at the end of
Dr.
our
Divla,
webinar. Yeah,
Dr.
but there's
Divla,
one question. Yes.
sorry, Dr. Divla, I have a question. If I may
Okay.
ask Dr. Dinesh before we conclude. One is, there is a problem I've noticed, and probably this is common globally also, that a person with vitiligo very often feel embarrassed with the look of other people. They themselves feel comfortable, and they are doing their role in society, they are doing their work, but the way people look at them, and at times they are even stigmatized, right? So what advice would you give to those people, you who have been devoting a lot of attention to this issue of vitiligo? And I must say that in Mauritius, they had this problem, and we, Global Rainbow Foundation, collaborated with them, and we even facilitated them to set up a Vitiligo Mauritius Foundation. So we are partners, and so what advice would you give, not only to the people with vitiligo, but to society at large? How should we address this issue so that these people are looked at as human beings with human rights, with dignity, and just like each one of us is different, therefore we should respect each one. That's the beauty of the diversity we have. Thank you.
Yes, rightly said. Now, as I was telling you, vitiligo is very much a stigmatized condition. Now, if you look at vitiligo from a medical point of view, it's just simple discoloration of skin, nothing else. There's no, it does not affect a person's functioning or internal organs or longevity of life. Also, The only impact it has on is the way a person perceives himself or the way the society perceives himself. Now, most often we are able to counsel the patients well, and we make the people accept that vitiligo or not, try to be comfortable in your skin. The problem comes where the way the society sees these people. Now, most commonly, sometimes in some societies, vitiligo is confused with leprosy. Now, leprosy is also a disease where they can develop a little bit of lessening of skin pigment, and it is a disease which is contagious. But leprosy and vitiligo are poles apart. So, and sometimes people think vitiligo is very contagious. You touch a person with vitiligo, you may contract vitiligo. Absolutely not. I have had cases where parents of prospective grooms or prospective brides do come up with us and they say, okay, this prospective groom or bride, they have vitiligo. How do we go about it? Now, if you look at it, any disorder can come randomly. Now, vitiligo can randomly affect 1 to 2% of the population. Anybody could get vitiligo at any point of time. I've seen babies get vitiligo. I've seen people elderly as about the age of 85 also suddenly develop vitiligo. It's an autoimmune disease. There's no predictability about vitiligo. It can affect anybody at any point of time in your life. Stress are aggravating factors. So 1 to 2% of the population can get affected. And it is our duty to, as physicians or as responsible peoples in the society like GRF, the foundation, it is to spread the word that vitiligo is not a contagious disease. People with vitiligo are very much capable and fit as every one of us. And also there are effective treatments for vitiligo, and the shame is not on the person suffering from vitiligo. The shame is always on the person stigmatizing vitiligo and demeaning a person with vitiligo. This is something which we need to really reach out. And also we need to make people aware that there are effective treatments aware. We should spend a lot of time and resources on educating public on vitiligo and trying to remove the stigma attached with vitiligo. Yeah.
Thank you very much, Doctor. Just a last question, some people, is the question of dermatological problem linked to seasons? So in winter, some people get some problem in winter and not in summer or something like that. Does it have some seasonal?
Yes, seasons generally do have a role. Now, if you look at summer, where like I am in a place where there's a lot of humidity. I don't know about your place. So in summer, we generally end up with patients having more of sweat-related issues, where excessive sweating can cause sweat retention issues like what we call as malaria, prickly heat. It could be that then there is something called a tropical eczema, where sometimes the excessive heat or sweating can produce eczematization of the skin. In rainy season, we see more of a fungal infections because of the moisture, because of improper drying of cloths, and improper need to take a bath. So we see a lot of fungal infections, and we generally see a lot of insect bite reactions also, especially mosquito bite induced reactions. So in the rainy season, we see increase in the mosquitoes, and then we simultaneously see a lot of people ending up with mosquito bite reactions. And in winter season, generally as we all know, that dry season or colder climates produce dryness of the skin. So in winter seasons, we see the elderly having more dryness, the senile xerosis getting aggravated much more, and people with atopic dermatitis, where the skin barrier is already compromised and skin is dry, getting much worse in the colder climates.
Thank you, Doctor. Before I invite Dr. Tribhulla to give the vote of thanks, let me say, Dr. Dinesh Kumar, this has been a very, very informative, and I have learned a lot of things from your presentation, and which will certainly guide me, but also help me to guide other people in terms of this problem. And what I would just make a proposal to you. The information you shared is very useful. That video will be shared widely in Mauritius and also will be on YouTube for the benefit of the greater community. But what I would like to suggest, we can discuss that. One concrete collaboration we would like between GRF Mauritius and GRF India. As you know, we have now the Global Rainbow Foundation in India. And so what my suggestion is, with your guidance, can we develop a brochure, a flyer that could give information as part of the education to people on these issues of dermatology, including vitiligo and so on? We can have one which that we can share with the common people, and we can have it will be a joint publication with you as the key person guiding and helping this to happen.
That would be absolutely fine, sir. I would be happy to be part of such a project, which always involves giving back to the society and doing good for the society.
Thank you. So we will have it, and it will be a joint one. In fact, tripartite. You'll be the key person, but Global Rainbow Foundation Mauritius and Global Rainbow Foundation India will be jointly using this to share information to those interested and concerned. So thank you very much for that. And I will leave now Dr. Divla to conclude and give the vote of thanks. Dr.
Okay,
Divla?
so Dr. Dinesh, there's one question from the audience. What kind of treatment for those who have very dry skin and or having symptoms like psoriasis patches?
Now, dry skin is just a simple use of moisturizer, and also they could possibly reduce their bath time and use non-irritant cleansers, and they could consider in taking more of increase in the intake of omega-3 fatty acids in case small fishes or nuts. So this will help them retain the moisture of the skin. And with regards to psoriasis, it's always better to consult a qualified dermatologist, because you could always misdiagnose or diagnose something else as psoriasis, or pick up something else also. So psoriasis, basically what we give is we give a moisturizer against psoriasis, but depending on the extent and type of psoriasis, we either go for creams like steroidal creams or calcineurin inhibitor creams or retinoid creams. And if the disease is extensive, where there is a need to control the disease and to prevent further damage happening in your joints and also the internal functioning, we go for oral medications also. And that would be
allow me.
medications.
Yeah, sorry, Dr. Divla. I just want to, since you are talking about that, I'm getting the thought about. I know you also have specialization or expertise in teledermatology service. Can you elaborate a little on that, because this is something which should be very, very useful, and I would like to get to know more about it and what can we do in that connection.
As I had told earlier on, most of the diagnosis in dermatology is based on visual inspection, and since we have good amount of cameras and we have the facility to connect across continents and across the seas, teledermatology would be a boon to help anybody who's in a place with not much of access to either a physician or a dermatologist to help access gain, and we could help it. Now, I happen to be the secretary of the International Society of Teledermatology, where we kind of try to work on developing modules of teledermatology for underserved areas, and not only that, we're working on artificial intelligence also. So basically, we need to have a good internet connectivity. We need to have a good quality camera or a mobile phone. More these days, the mobile phone itself doubles up for both of it. And we need to have a fixed time where a primary caregiver who's able to take the photographs and pass it on to the specialist, and the specialist will give the treatment and follow up as advised. So this is something which is possible, but it's going to be in a very structured manner.
Very good. Thank you very much, Doctor, from my side. And this is something I'll discuss more with you when I'll be in Chennai next week.
Sure, so
I'd like to discuss that and work out the modalities of how we can work together with you and your association of teledermatology. Thank you very much.
Thank you, sir.
Dr. Divla.
Okay, thank you very much, Dr. Dinesh, and thank you for all the participants. If there's any question in the audience, no. No, I don't think they have any questions. So thank you, Dr. Dinesh. So we'll see you next time for another webinar.
Yeah, thank you, Dr.
everyone.
Nita, and my gratitude to GRF Mauritius for the platform to share my thoughts with you all. Thank you all. It's been a
Thank you. Thank you.
good experience. Thank you. Bye-bye.